I'm Maggie Furman. I am the superintendent here at City Schools of Decatur, and I'm excited to host a town hall event with some amazing folks around the table to help answer questions and help our parents make sure that they have the information that they need to make a great decision. And we are hosting virtual, but we are really thankful to Decatur Housing Authority for letting us be live from the community center, because we have several parents here, as well as board member Gina Johnson-Davis, to listen in live. So we're excited to get started. Right. All right, well, greetings everyone. As I said, I'm Maggie Furman, superintendent here at City Schools of Decatur. And I want to thank everyone for attending this evening and listening in. Throughout the pandemic, we as educators have had to pivot more times than we can remember. We have had to provide instruction in a setting that we had no idea how to operate in, that we were never trained for. But thankfully, we have an amazing group of parents and support in our community to help us make sure that we were able to do this safely for our students and to give our students the best education that we could offer them. I'm going to introduce our panelists that are with us tonight in just a few minutes. But before I did that, I want to give everyone just an overview of how tonight is going to run. We're going to do introductions, and then we're going to do a quick presentation. Part of this presentation comes from questions that went out to our families, or a survey that went out to our families, and they had the opportunity to send in questions for this panel and for myself. And we had about 42 responses. And as I went through the responses, the majority of the questions were about our masking policy and about the additional option for quarantine. So we're going to spend the majority of our time tonight talking about those two, because they are a little bit different than what people have expected, or maybe are different from what we did in the past. I am going to give an overview of what we are doing kind of in general for our layered mitigation strategies. And for masking and quarantine, we're also going to have an opportunity for our panelists to speak from their expertise and their training about what are some of the pros and cons for each of these sides. So we make sure that we have both sides of the perspective so that people can make a decision on what the best educational setting is for them and their child. So I also wanted to make sure that everyone listening and here in person knows that the final decision for the policies and procedures here in City Schools of Decatur rests with our governance team and rests with the leaders in City Schools of Decatur. We took an opportunity to send feedback forms out. We reviewed information. This has been probably 10 weeks now. We've been sharing information, gathering feedback through surveys, through focus groups with faculty and staff. And then I've had several meetings with this panel to help inform my decisions. But I just want to make sure people are aware this is a City Schools of Decatur decision. The group that's here tonight answering questions and providing some expertise helped inform that decision. But it is the decision of City Schools of Decatur. I just wanted to make sure people were aware of that. And I want people to also know that as I made the decision with my team, we listened to both sides. We understand that there is a large group of parents that don't want us to wear masks. They think that it's time to take off masks and go back to school without masking. But we also have a large group of parents that really feel masking is still really important. And for City Schools of Decatur, we feel it is still important to continue masking. But I also know with our second quarantine option coming up that there is a group of parents that support that quarantine option, want to have that opportunity to have their child continue in school if they were exposed in the school setting, but there's a group of parents that don't agree with that. So as I went into this decision, I knew that we'd have people on both sides, but I have to make a decision so that our operations department can move forward, can get ready for school. And if we need to make changes as we go forward, we can definitely do that as we look at the data, as we check on, see how things are going. But we have to have a starting point to move forward so that we can get students starting school successfully on that very first day. All right, so without further ado, I'm going to introduce our panelists. And this is just a representation of some of the parents that served on this committee. So we had several other parents that also provide opportunities for input and share information. Some of them are online. Some of them had some last minute engagement, so they were not able to attend. But as I mentioned, I'm Dr. Furman, and with me tonight is Dr. Lily Huddleston. She is our Associate Superintendent. Welcome, Lily. We have Sergio Perez. He is attending virtually. Hey, Sergio. We also have Ms. Shonda Moore. She is our School Health Coordinator. Thank you, Shonda. And then I would be remiss if I did not mention a number of credentials of these parents, and Lily and Shonda as well, and Sergio, to helping advise the decision. So as I was looking up their bios and information, some of these individuals up here have like a 30-page resume. I was like, what? Oh my gosh, 30 pages of published articles and research and work with organizations. These are true experts that know what they're talking about and have a lot of experience. So I want to thank them for all of that dedication and volunteering their time to help us make a really well-informed decision. So first of all, know that I'm very grateful for all of you and really appreciate that. So we have, sitting around the table, we have Than Doan. He is an instructor at the Department of Orthopedics at Emory. We also have Dr. Jessica Doyle. She's a pediatrician at Oakhurst Pediatrics. We have Dr. Andy Shane, a board certified pediatric infectious disease physician practicing in Atlanta for 15 years. She is an uncompensated member as well of the ABC Collaborative. Online, we have David Siegel. He is a pediatric hematologist and oncologist. David, are you able to turn your camera on? Okay. Well, if you can later, David, we'll wave at you. All right. We also have Dr. Carmen Sultan. She is a pediatric emergency medicine physician at at Children's Healthcare of Atlanta and a medical director for procedural sedation at Eggleston campus. Welcome, Carmen. Thank you. Thanks for being here. And then online, I'm not sure if Dr. Sarah Slam is online. She's also a pediatric emergency medicine physician at Children's Healthcare of Atlanta at Scottish Rite and Wellstar Hospitals. And then Dr. Brian Vickery was also going to try to attend online. I don't know if I see Brian, but he is an associate professor of pulmonology, allergy, and immunology, also cystic fibrosis and sleep department at Pediatrics, Emory University, as well as the director of Food Allergy Center at Emory and Children. So as you can see, they've got a long list of credentials and are really here to help inform our decisions and have done a great job with that. So next, I just want to give a quick overview of our mitigation strategies. And if you've been watching any of our presentations, we've shown this slide before in a similar fashion. And it gives that Swiss cheese model where we have a layered approach to our mitigation strategies. And in City Schools of Decatur, we focus on 7 key mitigation strategies. Number one, first and foremost, now that we have a vaccine available, we really focus on making sure that all of our students and staff and students that are eligible vaccinated for the vaccine. That is the number one mitigation strategy. The second one is universal masking. We're going to talk about that a little bit. Physical distancing, that is keeping our students as far away from each other as possible in the classroom settings. And hand washing and respiratory etiquette, another huge important mitigation strategy, as well as making sure we're cleaning high touch areas and just having really well cleaned buildings. Our next one is contact tracing, which includes quarantine and isolation. And then our last one, ventilation, where we've added HEPA filters to every classroom across the district. So we use those mitigation strategies as a layered approach. And that's what's really important, because if one of them fails or one of them isn't as efficient as others, we have an opportunity to have those other layers really help catch what any particulars or virus, or help decrease the spread of the virus. So that's why we use those layered approaches. Now the CDC has not yet shared new guidance for the upcoming school year, but they said they're going to send it out tomorrow. And it seems like every time I make an announcement or share a presentation, it's like the next day the CDC says, hey, here's some new guidance. I'm like, what? I think they know. They're like, when is she putting it? Okay, we'll do it the next day. But so tomorrow we will get updates. And if there's anything drastically different, we will look at our mitigation plans, review what's feasible, and make any updates as we go forward. The 2 mitigation strategies that I do want to make sure that everyone knows that the CDC really says are essential is masking and physical distancing. So they do pick out 2 strategies as really essential to put into your schools. And the CDC will also say, do what is practical for your school, because sometimes there's things that aren't practical that you cannot do in a school building, but we do the best we can. We try to make it work the best we can. I did want to share updated vaccination status data with everyone as well. If you didn't realize this, you can drill down to census tract data online through the Georgia Vaccination, the Georgia DPH website. And here I've highlighted what our vaccination rate is within the census tracts within Decatur. So you can see our vaccination status for 12 years and older ranges between 43% and 60%. And I'll tell you, I really feel that those lower numbers that are in the 40s, that's where we have Winona Park and Oakhurst. So there's lots more students in those two zones than in the upper levels, because those are our smaller elementary schools. So I have a feeling that that's why those numbers may be a little bit lower on that side of Decatur. Okay, so let's talk about masking. So City Schools of Decatur did decide that we are going to do universal masking for all students aged 3 up through 12th grade, for teachers and for staff. We really feel strongly that our staff have to be good role models for our students and wear masks when students are around. So we do want to do that. And we also believe that wearing masks is essential to help the spread of COVID, to minimize that spread of COVID within our school system. And we've seen last year we had really good mask compliance with our students. As I visited schools closer to the end of the year, they were really good about wearing their masks and helping other students remember how to wear their masks appropriately as well. So we are going to continue with masking with a couple changes. So mandatory masks, indoor buildings. If the teachers are outside and taking kids outside for either recess or an outdoor activity, masks are highly recommended if they cannot do at least 3 feet of social distancing while outside. And then also for our teachers, this was one of the questions that came in through the form, was about teachers teaching phonics. We know that when students are learning phonics, that it's easy, they really should see the mouth of the teacher move to make sounds. And teachers that are fully vaccinated can take their masks off when they are teaching phonics to their students in the classroom so that they can see those mouth movements that are really essential. So that really is the nutshell of our masking mandate, is we really just feel that it is the most appropriate strategy. It's the least invasive strategy. And it's kind of a no-brainer for me. If we can help prevent the spread of COVID by wearing masks, and not just COVID, but other airborne diseases, let's do that at least for the start of the school year and see how things go. So what I'm going to do is, if our panelists, if any of them have information that they want to share about pros or cons of wearing masks on either side, kind of give a glimpse to the community of how our conversations went when I met with this team, because they very much were pros and cons about this to help make sure I had that informed decision. So anyone want to share?
So I'll just start from sort of the pediatric infectious disease bias, and so this is where I'm coming from. I think, right now we're also seeing a lot of other respiratory viruses that are not SARS-CoV-2, which is the virus that causes COVID-19, circulating, and we have seen a very small peak that has occurred after the July 4th holidays. So we know that when people went and socialized, what we're going to see at the beginning of school is bringing together people who have been in various places, in various settings, who have not been around each other. And really the safest thing to do is to start the school year with everybody masking and seeing what happens. We don't know what is going to happen with this Delta variant that's circulating. And it's especially important in schools where children cannot be vaccinated because they're not age eligible. So I think that, nobody likes them. We love seeing each other's faces. It's hard to not see smiles and facial expressions, especially for younger children and also older children. But I think that the safest way to start the school year is with universal masking. Look and monitor very closely and see how we do, and then make adjustments based on that.
Great. So Atan and I actually have a kid that's in high school, so I kind of see the viewpoints for the high school that vaccination is available for most individuals in the schools. And so I was really hoping that, the city of Decatur would sort of change their policy to enable optional for masking in high school. But I understand that's not the case, and that's fine. That's I respect the leaders, and I appreciate the leaders for taking into consideration of the option. And I think, we're starting the school years with mask requirement in high school, which is great. But I have a feeling that CDC will update their guidelines, and hopefully when they do, we'll see something different. Just to make sure everyone understands, I think a lot of schools around the district here are doing optional in K through 12, which I don't really encourage, because I think it's very important that people who are not vaccinated or have optional not vaccinated to still be masked. I think it's still contagious, and we need to be aware that we don't want to keep spreading it in the community.
Yeah, I think the major debate, within the committee was the high school versus not high school. I think people in general felt that at this beginning of this year, with the younger kids not being able to be vaccinated, that it was important to continue masking. Delta may be an issue, it may not be an issue, we don't really know yet, but just to continue that mitigation for the beginning of the school year. I think would hope that the goal eventually is to not be masked. I do think that developmentally it's important for kids, learning phonics, learning to read, talking to each other, seeing each other's expressions, for them to not be masked all the time. But I think in this situation, it's important to continue to mask.
I'm just going to piggyback off of Andy. I think in the emergency department, we are seeing quite a spike of respiratory illnesses that are not COVID related. RSV is out there, paraflu is out there, and it's making kids quite sick. And I think a lot of these viruses look, talk, and walk alike. So I think going into the school year, it's very predictable. When school starts at about 2 weeks, that's when all the viral illnesses kind of start to appear. So I think this is the right thing to do. I think it's the safer thing to do. It's easier to walk this back than to have outbreaks and then to have to come up with strategies to correct our problems. I think it's easier to walk back the mask policy. So I think that what works for the city schools of Decatur works for the city schools of Decatur. We cannot base our guidelines on what works for DeKalb County or Clayton County or whatever, because it's a different size, it's different patient or student populations. So I think we have to make our own independent and creative decisions.
And I think with the hope that, we have a lot of respiratory illnesses going in, we are hoping to keep kids in school as much as possible. And that means, we are asking people who are symptomatic for any reason to not attend school. So, if we can decrease the amount of colds that everybody is getting, whether it's from COVID or from something else, it will increase our children's time in school.
And that was one of the questions that came in, is if we know that masks help prevent other airborne illnesses like colds and flu, why don't we just have to wear masks all day, every day for the end of time for schooling? And so that, I hear that it is something that will help prevent that now, but also, once we have a danger of a virus we don't know anything about, that I think we can relax those. So I think that's just one of the things where we know it's the safest way to start. It's what works best for City Schools of Decatur. So it's how we're going to get the year started.
I agree. And I think we can't make the assumption that all of our high school students have been vaccinated. I'm a parent. I'm also a staff member with CDC.
Getting a new job.
With CSD. And again, my daughter has friends, and I know that they haven't been vaccinated because the parents are still trying to figure this thing out. So until we are permitted to require that, like we do other immunizations, we cannot just assume that these students have been vaccinated. And I think slowly moving towards, maybe once we watch things, then I think we can make changes. But as of right now, I think we're just moving too quickly by saying let's get rid of masks.
Yep, agree. Or any of the panelists online, did anyone want to share? Okay, they guess not. All right, anything else from the panel about masking?
I just wanted to share that based on our time since March, this has really been proven to work. Even when we had staff members and been growing the numbers, masking has been effective in this district. So I think that it's important, and I agree with everything that people have shared so far. So I think this is the way to go to start out the school year.
Awesome, well, thank you. All right, so we will move on to the next big topic that brought a lot of questions, and that is an update to our quarantine policy. So first, I want to make sure that people understand we're not changing isolation. Isolation means if someone tests positive for COVID, they have to stay home for a certain amount of time. We're going to explain what that looks like in a couple slides. So anyone that does test positive, they are not in our buildings. And then we've developed two options for quarantine. So option one is if it's a close contact. So for this instance, if Carmen and I were sitting this close to each other for an extended period of time, I test COVID positive, Carmen is, let's say she's an unvaccinated student, she has to do a quarantine option. So one of the options is the normal quarantine that we used for last year. We're going to talk a little bit about how students can end their quarantine early with a negative COVID test, and if they're asymptomatic. But the other option is if a student is asymptomatic, they've been in close contact at the school setting, they can continue to attend school, still wearing a mask, still completing all the other mitigation strategies that we have in place. And I'm going to walk through just a little bit of information for our audience so they get a better picture of what our classrooms might look like. So here's a graph of what a typical K-5 classroom setup might look like. So usually 5 to 6 desks. Our average class size typically is around 24, and that's the number of students that are pictured in this diagram. Right now, our average class sizes in 3-5 are only 22, so you would take 2 students out of this diagram. And then our 3-5 classes, their average class size right now is 18, so it's even fewer students. So we're able to distance those students even more in those lower grades, in those K2 setting. So what you'll see on this diagram, and this is just the pure math based on the size of the tables that we have in our classrooms, and they're 12 by 2. So when you do the math, I had to break out my Pythagorean theorem calculator today to figure out the math, but thank goodness I remembered that. So you see the distance between students A and B, between B and D, between D and C and A, that's 6.3 feet. So that means those students that are sitting on the edges are not considered close contact because they're further than 6 feet away. So in this diagram, the student A and E, they're closer than 6 feet, so they would be in close contact. But then the only other 2 close contacts that I've labeled here are B and C. So just so parents kind of see when we diagram out a classroom, now this is like the perfect diagram of a classroom. Like, hey, if we have an actual rectangle room with no other furniture on the walls or bookshelves or teacher desks, this is what it would look like. But this is just to give parents kind of an idea of what our classroom setups might look like and how students are arranged around tables. So one of the questions that came in was about non-school exposure and why do those people have to follow quarantine option 1? So, and we outlined a sample here, and so child X developed symptoms on Thanksgiving Day. Her parents take her to be tested on the Friday after Thanksgiving. She tests positive for COVID. Her parents then inform the school on Monday that she's now has to follow DeKalb County Board of Health isolation because she has tested COVID positive. So that is an isolation case. But also what we want to clarify here is that she has a sister. This other child also attends a CSD school, and parent A is also a staff member. So because they had close contact with a COVID positive person outside of the school setting, where we cannot say, hey, here's what our mitigation strategies have been and have been monitored for efficacy, we cannot guarantee that any of these people did not contract COVID from this close contact. So that's why people outside of our school setting that may be in close contact have to follow the county procedures. And then I wanted to share an in-school example where we would tell the parent they have an option of option 1 or option 2. So in this diagram, student C, let me move a little some stuff around here, sorry. Okay, so student C in this diagram down here, it starts developing symptoms Monday after the child goes home from school. Parent then decides Tuesday to keep the child home from school, takes the child for a COVID test on Tuesday. They don't get the results till Wednesday afternoon, but they've kept the child home Tuesday and Wednesday. And then Thursday morning, the parent calls the school and says, hey, child C, sorry, she tested positive for COVID. We found out last night. She won't be coming to school. And we'll talk about the isolation here. So then once that notification is made, our contact tracing teams go to work. So they start looking at the seating charts, identifying how the students have interacted, what classes they've been to. So let's say they look at this classroom and the seating chart and they say, okay, this is the student that tested positive. Technically, and I know like this is just based on the math, these two, A and D, sit at the same table, but they're further than 6 feet away. So they're not considered close contact. So those are students that would not be mandated to quarantine based on guidance from DPH and the CDC. But student B does sit just 2 feet away. So that is a student that would have to pick one of our quarantine options. So quarantine, so child B, less than 6 feet, they have to select. I just want to clarify that student C, that is the student that was COVID positive. They are isolating and they must isolate for 10 days. And depending on testing and ending of symptoms, that date could change. The earliest they could return to school would be September 23rd based on the date of testing positive. So then let's talk about student B. Let's assume the student is not vaccinated, because if they are vaccinated, they don't have to quarantine at all. So the unvaccinated student, if they remain symptom-free, they can remain in the school setting. They still have to wear a mask. They still have to social distance. They still have to wash the hands and do all the other pieces of our mitigation plan to make sure that we are, like that Swiss cheese model, we're keeping all those other layers in place. If that student tests, we highly recommend students test on the 5th day after exposure. And if the child tests negative, then the quarantine can be lifted on the 21st. So that's kind of an outline of our quarantine options for our parents. Oh. Then I did want to clarify that, well, outside, so regardless of where you have been in close contact, you have to quarantine while you're outside of the school setting. And again, that is just being very extra cautious of, in school, we can control the mitigation strategies very, very effectively. We can watch our students, we can let people, you know, we can maintain social distance, we can guide our students, we can remind them of things, help them remember to wash their hands. When students aren't in our buildings, we have less control over that. So that's why we are saying outside of school, we are recommending and would say, yes, the student needs to quarantine through all other activities. So no after school childcare, unless that's something independently the parent has done within their own thing, but they should be at home. No after school activities, no athletics, they should just be in their house. We also have the option and strongly encourage 5 days after contact for the student to test for COVID, and that if symptoms come, they have to let us know at the school level. So we need to know if a student or do they test positive start showing symptoms. Okay, so before we get into the discussion, I did want to also just give some more rationale about why we're making this decision and why this is kind of the route we went down. So my goal is to minimize disruption. We know that we lost a lot of learning last year, a lot of in-person seat time, a lot of face-to-face time, and we need to make sure that this year we minimize any disruption to our students' learning as much as possible. And just to give you some data, last year between January 19th, when we started back to in-person learning, to May 1st, we had 278 students that we had to isolate. So that means within that time frame, 278 either staff or students tested positive for COVID and had exposure to people while they were in our buildings. So these 278 individuals had close contact with 3,400 other individuals. So then if we look at those individuals and we say they've had to now quarantine, we'll say the average quarantine date or day range was 12. And if we then multiply that by the 3,400, that's over 25,000 days of instruction or in-person learning that could have been lost for these students. That's why it's so important that we try to minimize that as much as possible. I also did a quick Google search of modified quarantines in schools. And it was pages and pages and pages of other school districts that are already doing this. Some started last November as I looked up their data. So it's not like Decatur is going outside of the norm. We're looking at what works for us and based on our data, doing what I believe is right to make sure our students get the best education that we can offer. Also, just wanted to note the entire state of Ohio is doing a modified quarantine. So their whole the Ohio Department of Health for a state is using this model to minimize learning loss for their students. So that's part of the reason that I made that decision. And I'm now going to turn it over to our experts to talk about some of the positives, some of the possible drawbacks or limitations, or some issues that may come up with this option or option one.
So I think there were some questions about, a quarantine classroom where the students would be separated from their class and put into a classroom with either other quarantine people or, with a separate educator. And, we talked through that and thought about that. The cons of that were, needing an additional instructor for, maybe that one or two people, and pulling them away from a larger classroom. Also, just the idea that if we needed to have a quarantine classroom with multiple quarantine students from different classes, that was going to mix cohorts, possibly. And just the disruption for the students with their teacher. I think that was a really big, I know for my children, that was a really big issue last year with the changes. Every time we made a change, it was like, oh, you might have to switch your teacher again. And, I think the teachers really have a bond with the kids, and the kids get a bond with the teachers, and, they know each other. And it's hard for students to pull out of that and learn with a new instructor, and possibly, going back to a slide deck or, virtually, or, whatever their choice was going to be. So I know that was a question for a lot of people, why this versus, kind of pulling them out into an additional quarantine classroom.
And I think one of the data pieces was why risk it? And like, why would you even think about putting a child in danger? But I think based on articles that I've read and things that have come my way, there is a risk. There's a risk with anything. There's a risk with me driving my car to get to work. There is a risk of something terrible happening. We all have that innate risk, but the risk is so low that we know that in our school year last year, it was point whatever possible transmission, that's I'm okay with that, to make sure that our students are learning. And we also know that spread, not just in Decatur, was so low, but across our nation. And in international studies, we've seen that the spread transmission of COVID in schools is very, very low.
I think a couple of things, and I think Andy is going to have to speak a little bit on some of these things because she spearheaded some of the writing of this document. But I think one of the things that we're going to have to reconcile at some point is how we know exactly what the vaccination rate is at the Renfrew level and higher. I think that's critical to making this work, because you have there that kids that are not vaccinated don't have to quarantine at all. And I think it's going to be critical that families and parents and administrators are able to, with certainty, figure out who is vaccinated and who is not. The ticket out of this is raising our vaccination rates. And that's not just for kids, but that's for all humans here.
How is it that you're going to know if a child has had vaccination? Would you ask for their cards?
Well, that was my question. I think that's something we're going to have to reconcile.
And I can share. So what we're going to do is when parents do their annual data verification, they'll have part of that data verification will be, yes, I'm vaccinated, upload a snapshot of their vaccine card. No, I'm not vaccinated, or I prefer not to answer. So they will not have to share, but we will want to know where they are with their vaccine status. And we'll do a similar form for staff.
And people who choose not to share will be subject to the
correct. Yes. Yep.
Regular quarantine.
I also think that it's very possible that this may work. I think it's very possible, based on other school districts that have had success, this may work for us. I think it's also possible that, kind of like we talked about, this virus changes rapidly. That's how viruses survive. They keep mutating to make themselves survive. And I think we know that going into the school year, there's going to be a lot of changes. You're going to have updated CDC guidelines. You're going to have spikes periodically throughout the year. So I think we need to kind of shift our thinking a little bit as to how we're going to creatively deal with some of these problems, not if, but when they arise. So if we have children that don't have after school capabilities or after school programs, or if we have to go back to the traditional CDC guidelines for quarantine, how are we going to deal with those things? I think those are some of the things that we need to be thinking about now, as opposed to in September, October. I think that there also has to be, and we talked about this in our committee meetings, there has to be some metric whereby we decide that this particular policy is not successful. So is it based solely on community spread? Is it based on inpatient hospital bed availability, ICU admissions? Is it based on spread within the school system? I think that has got to be a critical conversation with infectious disease experts, also with the Department of Health, because there has to be a stop point whereby we say and acknowledge this is not CDC guidelines, unless the CDC guidelines for school changed in the next 24 hours, which they may. then we say that there's a stop point and we're going to go back to the traditional CDC guidelines. But I think parents have to know and understand, and we have to be thinking ahead of the curve here about how we're going to head off some of these problems.
Yeah, no, I agree completely, Carmen, and I think, Dr. Furman and Dr. Huddleston and I had a conversation with the CAB and Georgia DPH today, trying to go through some of those issues and some of those concerns. So I think that that's really important to think about those. It's also probably going to differ at the high school versus at the elementary school, and depending, and hopefully when vaccination is opened up and expanded for children. But I agree. The other parts of it too are really making sure that we follow very closely everybody who is subject to both types of quarantine and really tracking that. And we're going to need community support and parent support to tell us when children develop symptoms at home, taking advantage of the testing that we're offering, because that's really a very important way of understanding whether it's SARS-CoV-2 or some other virus that's circulating that's causing a problem. So that's going to be really important. And we're going to it's going to have to be a two-way communication with families. We're offering this because we want to try to keep children in school and continue learning, but we also need collaboration from families and really helping us understand. And really, if a child has symptoms, they should not come to school. That's really, no matter what the reason is. And that is very challenging for a parent. I am a parent, I know that, my child gets ill, but I think it's going to really be a two-way street and lots of collaboration. So.
And I'll just add, Maggie, I mean, you brought together a really great plan because you provide a lot of options and flexibility for people within the classroom. So you talk about, people with close contact, but you also provide in your recent messaging that if the kid is in the same classroom and you feel unsafe, you do have the option of quarantining until, you feel safe to come back. So I think that's a great way to compensate and adjust for people who feel maybe it's not the best environment for their kid at that moment. And they could take the kid out and do virtual, and then come back in. So I think, the way I saw the plan worked out seems to be pretty good. And I really appreciate and like that you're able to ask parents to upload their vaccination card for the high school, because we'll have a better read by then of, what the percentage and stuff like that for the kids at that level. Okay.
And I think we just need to, I think we're all very worried about how Delta will turn out, but Delta's not going to be the last one. We're going to have Delta Plus, we have Lambda, we're going to have the whole Greek alphabet, so we have to figure out how we're going to keep kids in school, despite the fact that we are going to likely have, surges, we're going to likely have variants, that's going to be life, until we can vaccinate the world, we are going to be dealing with COVID.
Anyone else? Anyone online? I saw a couple of our panelists online.
Hi, this is David Siegel. Can you hear me from the panel?
Yeah, go for it.
Hey, sorry I couldn't be here in person. Sorry for the technical difficulty earlier, but thank you for the ability to talk. Yeah, I appreciate inclusion in this panel. And yeah, I just want to say that, there are some limitations to this option. I wanted to make sure families understood that, which is, yes, it is true that transmission rates were low last year, but there are some important differences between the data last year and what would be going forward in August. So, for example, schools will be in session full days with unmasked lunches. There'll be different quarantine options. And, there will be this Delta variant, which we do know is going to be the predominant strain in August, which is different than the past. It's 60% more infectious. The rules might be different. It might be that it might not be 15 minutes of exposure that causes transmission, might just be seconds. So, I appreciate the ability of the panel to anticipate new changes, but this plan was developed before we knew about Delta. So, I think the problem with Delta is that it's so new. And I know there's a lot of Greek alphabet concerns, as you mentioned, but, this is a different type of transmission rate. And I think that has to be taken seriously. The plan developed here did not really take into account these new different rules. And, I think it's really important that going forward, the school is very nimble in changing this if we need to. We don't have a lot of data on this. All we have is a few reports of outbreaks from summer camps and schools in the UK. So I think it's important that parents understand that this plan, as it was developed, didn't taken this new variant into account. So that was one of the questions that was asked through the system. So I wanted to make sure that was addressed, that some of the data that's used to fit this plan really needs to be evaluated very rapidly as we go through. Case data lags what we actually would see in the, what actually would be circulating in the school, because there is a few week lag there. So I think it's important that our plan is very nimble and has a lot of discussions with the CAB and other public health agencies to make sure we are able to make changes if possible. Also, I did want to say that, I know Maggie said that, Dr. Furman said that this was done at other schools, and that is true, but this is really an experimental design that is not the same as CDC guidance. CDC guidance is very specific, and it says quarantine students could return to class after 7 days, as long as they have a negative test after days 5 to 7. So, I just think it's important the community to understand this is a departure from CDC guidance. CDC guidance does allow for some flexibility, but this is a plan that's been done only in a few schools in the country where we actually have results and reports of how those outcomes looked. And there are differences in those outcomes versus what would go on in the fall. The other outcomes were pre-Delta, had open windows, and had mandatory testing in some cases. So, one point that was mentioned before is that students would have the ability to self-isolate, not self-isolate, but to exclude themselves while this was going on in the classroom in terms of option 2. And, without mandatory testing, there's no endpoint there. There's no ability to detect if an asymptomatic series of spreads is happening in the school classroom. So, I think that's one drawback of this policy that I think that parents need to understand. And then just my final point is that when someone makes a choice of option 1 or option 2, the risk of that choice belongs not to the person making that choice. The risk is distributed to the other students in the class. So I think a lot of parents, might not feel comfortable with that, and especially for ages less than 12, where there's not an ability to vaccinate. A lot of families have kept out the full year in order to have a safe environment for the fall, and a lot of people in this plan would have to make a choice for having a safe environment for them, and then or being in school. So, this is applicable to students less than 12, to immunocompromised staff and students, and they might not have the option to protect themselves using this type of plan. So I just wanted to say, I appreciate everyone's work on this, and I think this plan makes a special sense for ages above 12, but I was one of the members who did not like this plan, and I appreciate that decision had to be made. I would pass on that, if you do not like this plan, I would say to write the board. That's what Dr. Furman suggested to us on the panel. So, any advice would be appreciated, and I definitely appreciate it for this plan, the ability to be nimble and adapt if needed. Thank you.
Thank you, David. All right, were any other panelists online that wanted to share? Oh, right here, yeah. All right, so no one else, any other comments from the panel in person?
So I'll just mention just one other comment also, that a lot of the information when these other school systems have tried this plan was also without mass vaccination of people, well, 18 and above and then 12 and above. So I appreciate that we don't have any data right this second, but we also, numbers, we have to take into consideration that we have notable rates of vaccination and hopefully higher as we continue to go on. I'd also say that in the summer school experience, we did not have, that we're not aware of any transmission that occurred. So I think that's, and certainly if the Delta variant may or may not, we don't know exactly if it's been circulating here in this community at the same rates that it has been in other places. But I think that's something that's reassuring to know.
And I think also that our community rates are way lower than they were. I mean, I think a lot of these places that did the modified quarantine in the winter, community rates were very high, and they were successful with that. They had no vaccines, and they were in very high community rates. So I think the trend with rates in schools tends to trend the cases in school come from the community. So the higher the community rates, the more possible cases in school you'll have. So with really low community rates right now, that should be protective as well. And also with the vaccines, I think as we do with newborns, we sort of cocoon those who can't be vaccinated with all the people who can get vaccines. And so if we can do that in our community and raise the vaccination rates, that's going to help out significantly. So.
I just want to point out that there are multiple levels and facets to that, right? Because you have, just like David said, you have immunocompromised staff, you have, your bus drivers, cafeteria workers who are overwhelmingly folks of color who are, over the age of, 50 or 55 that are at higher risk. So we have to keep that narrative in mind. We just have to speak on it and keep that in mind. And while we know that the rate of transmission from children to adults is low, it's not zero. So I think that that's where, like I said, we have to be clear going into this that it may work, but if it's not, we're going to go back to what the CDC says. And like David said, we need to be clear with families that this is a departure from the CDC guidelines. And if the CDC guidelines come out tomorrow and say this is what we should do, then we need to be clear about that as well. But I think that they're kind of like David said, there's multiple folks who are involved here, not just the child who ultimately picks option 1 or option 2. There's multiple people who are involved in that narrative there.
So was there a difference between the half-a-day students and the full-day students that went to the pods, participated in the pods, as far as like being more exposed, more hours in the day? I know he was saying something about comparison to the half-a-day and the full day, but I couldn't really hear what he was saying. So has there been any? I mean, I know the kids in pods have come up with the symptoms and stuff like that. So a full day at school for kids that's vaccinated, not vaccinated, coming in contact with other people, stuff like that. And I understand that you have the option 1, option 2 quarantine, but have you thought about there would be more transmissions now that everybody's required to be back in school? Is this the protocol for a full day and not based on what was happening?
Yes. Yeah.
So could I comment to that, please? So I think, so I was on the mitigation group right back in November and October when we started this, and we actually talked about the scenario of half days and full days. And for our group, we did not really see the benefit of doing half day for full day. The only difference that the district saw was that the lunch issue. So because of the lunch issue, the district decided to do half day. But as far as doing a full day, being in the same class, that was not going to affect your transmission of the virus, okay? Because if you're sitting there for 4 hours or 8 hours, it's not really that much difference in our view, okay? So going to full days, the only thing that is very different that we discussed is the lunch issue, and I think we've kind of worked around that this year. Also to remind you that CDC has also said in school it's actually 3 feet of social distancing, not 6 feet. It's, so that there's data out there suggesting that 3 feet is pretty well documented that it's pretty safe or lower risk, and not have to do the 6 feet distance. Now, as far as the in the lower grades, the K to 5, I believe they're kind of cohorted. So they stay with the same group of kids the whole time. So doing the sort of the option 2, they're kind of quarantined because they're staying with the same group of kids. Now, the important thing that Maggie's pointed out in her discussion on this is that the schools are very much a control environment. We do have 7 layers of mitigation in place. And now we're just taking sort of 1 layer out, which is the quarantine stage. But there's still 6 other elements in place. this is very different from you contracting outside, like Maggie's pointed out, because then if you're in a home, there's no mask wearing probably. There's no increased ventilation that we've done in schools, and there's no clean hygiene or whatever that's always emphasized in school. So I think the reason why I think the model, or what we consider option 2 works really well is because it's a very much a controlled environment. And it's been shown that in school transmission is very low. If you even look at the case numbers, the case number community is always much higher than what is actually known in the school case number. I've looked at several studies around this because it was one area of my interest. And the case numbers that's been reported in schools is always much lower than community case. And right now, our community case is 15.6 over a 7-day average here in Decatur, actually, in DeKalb County. So thinking about that, and that's actually including adults. So how much of that number is actually truly kids is a different story. So I think, the transmission rate or the case number in the community is very low, in my view. So, because of that, and because of 3 feet distance that we're having a mask requirement in school, there's a lot of layers that kind of reduce the risk overall for these kids, and without, and not disrupting their education and learning experience. So.
Did you have a question?
I was going to say, I was going to say that it was a lot of places giving out the vaccine, but it was kind of hard for people to get to the locations as to where they would give the vaccines out. And could we, as a community, provide somewhere where it would be much easier for our children to get the vaccine if they wanted it, the vaccine, and could it be school or maybe here, so they could get to a place to get the vaccine.
Yeah,
a lot of people don't get information because I know to have pediatrics, right?
Mm-hmm.
Right.
I took my second dose of Pfizer there, and I think at one point there was offering for the kids. But my granddaughter, she had to go all the way out with that to Kaiser to get her one of her shots today. So I think a lot of people don't give a lot of information because a lot of people don't, and I'm not saying that they shouldn't read. Some people just don't know. And we have made an effort, Mr. Corey and the whole Housing Authority team has made an effort to help get people vaccinated. And sometimes the parents are working or they have the kids' siblings have to help take care of the other siblings. And sometimes it's hard. And if they do a vaccination, it's like, by the time they get it coordinated, it's kind of like, it might be like last minute. A lot of people can't participate, but not that a lot of people might not want to participate. Because I know when I was trying to get vaccinated, I wasn't going to get it at first. And then I said, well, I'd rather be safe than sorry. But I had to go all the way to Ellenwood for my first dose. So it's like, then they take you to navigate the website. I'm not one to be, I have to work on the computer when I have to, but on the other side, I don't have time for that. Then you can't get through it. People give up. And that's how a lot of people become non-vaccinated because it was such a inconvenience. Not that they don't want to, but it's just totally inconvenient. Unless you just say, hey, I'm coming to your house and I'm going to give you this dose and come and take care of you. It really was not a very, it was rushed and it was not a lot of information because a lot of people don't like to put stuff in their bodies or, people have cultural beliefs that they don't believe in certain things. And it's scary because people are dying. And then you got people saying, hey, you better take this thing. And I'm like, I don't know if this thing will work. It's experimental. We don't know. We don't have no data on anything except for what they say. And the test is so, I think that maybe this year, whenever it's time to revaccinate, it might be a little better as far as some cultures and maybe for my community, I can't really say because I don't have no data on it, so don't quote me on it. But I think for a lot of people, it would be maybe this time around, when it come back around, it'll be a little better.
Yeah.
And people will see what the results are from first study.
So I'd like to address that. So, great idea. I recently, well, let me clarify. For the past 2 years, I've been with the district. And my role initially was just the lead nurse. So I was working with the nursing team primarily. And this year, I've taken on some new roles where I'm going to be the school health coordinator. So I'll be working on wellness. And I'm very excited about that. And one of my first jobs that I did was I reached out to the DeKalb Board of Health, asking that they provide us with a mobile vaccine unit. So I'm hoping that that will be okayed and it will come about on July 19th. And as soon as I hear back from them, I'm going to get that information out to the community. I'd love to work with your team to make sure that we can coordinate that together, or any other things that, and I get it, because I am an African-American woman and I had my concerns as well initially, especially because I'm, again, a staff member, but I'm also a mother of an African-American children, so I understand that. So
will you be doing children and adults, or just?
Well, that was my request. I put that in. It's really up to DeKalb. They asked me on the form that I had to, in my communication between them, if I wanted it to just be for children. I said, no, I'd like it for 12 beyond. And so, and I know that they have the capability of doing that because I've worked with them at other sites in the past. And they asked what kind of vaccines we prefer. I said all of them. So I'm waiting to hear back. And as soon as I hear something, I want to start marketing that and getting that out to the community, so that the hopes is that it will be right over here at the high school, that we can park the van over there, or right down here. And I'm sure I can put in to have it in other areas. They just want to know, who do we need it for? How many do we think will come? And I'm so excited to hear that, you know, you believe that more will come, because I would love to work with you. I'm excited about that.
And I think also, like, if they're going to be doing sports, is there a requirement for the vaccination for sporting events and stuff? Because that would be a good time to have those mobile buses for the kids that's doing sports, because they're there, they want to participate. And that would be a good time also to explain, you know, not saying I'm making you take this vaccine, but it's here and it's available and it's convenient. Because going back to second doses, because most doses was Pfizer, then you got to fight for a second dose. And then realistically, you know, our community is a working community, and it's a lot of stuff is, you know, I know you have to prioritize, but sometimes it's the priority is going out, making a living, not trying to find a first dose, second dose, and you don't know what you're going to get till you get there. So it's like, it's a catch-22 for some people. It's not all straight line situation for everybody. And I understand that in, you know, in different aspects of people's lives. So
Thank you.
that's why I saw a lot of, I think I saw a lot of hiccups with this vaccine this year.
Thank you for sharing that. Appreciate that. And that perspective is really important for us. So yes, Shonda, connect with Ms. T.
I would love to.
So the last thing I want to just raise is we will be evaluating this option. And if we see that it's not appropriate any longer, we won't be using this option. So it is not like, I'm not a diehard, hey, we're going to do this. There's no ifs, ands, or buts about it. Is I'm going to use it. We're going to look at the data. We're going to make a determination if it's something that we can keep using or we should not keep using. We're going to schedule calls on a regular basis with the Georgia and DeKalb boards of health to share our data and what we're seeing as we collect data for our data dashboard. So just so people know, we will be looking at this. We will be discussing it with the Board of Health as we continue to use this option. And if it looks like, hey, not such a great, we'll stop using that. Just a couple other quick Q&As. So there were several questions in about lunch procedures. And the question came up about that as well here. With full days and we're going to have lunches. So we will prefer, strongly encourage outside eating, but we know July and August, it is hot in September. And kids don't like to eat outside when it's really hot, but our principals have been making arrangements and organizing their schools so that they can distance students when they have to take their masks off to eat. There was another question about after school activities and clubs, and we want to be as normal as possible. So we will have the full complement of after school clubs, sports, activities. In the middle school, all of our clubs, we are opening back up our partnership with the city for the animal crackers clubs at our elementary schools. So we will be back to those full opportunities for students to engage. We talked about alignment with CDC and DPH guidance. There was a question about that. And as I mentioned earlier, it's look at what the guidance they provide. And even the CDC says, do it, add it to the practicality that you can as a school. And just like I shared earlier, we feel strongly with this modified quarantine option or option 2, that the other mitigation strategies are strong and will help make sure that we see minimal or zero transmission in our schools. We talked a little bit about what our mitigation strategies look like compared with other school districts. I did have conversations with every other school superintendent, except for APS. I still haven't heard back from Lisa about what they're doing for masking yet. We are the only district that I know of requiring masks, and I understand that, and that is like outside of the norm for what other districts are, but I'm okay with that because it means our students will be healthier and they'll be in school for more days. I talked about the vaccine tracking already, and then there was another question in there about viral testing. And the question was about using the Binox Now test that we have for asymptomatic people. I'm not an expert on that, but I know that we were approved, and it is a FDA approved, correct, to use it on asymptomatic people. So we are going to use it in that way to check our students after a 5th day of exposure. I highly recommend that. So we are going to use it that way because we've had that approval for it. We just feel like that is another added layer of mitigation that we have opportunity for. So,
Maggie, can I say a quick thing about testing?
Yeah.
I think, the testing, I think ideally everybody would get a rapid PCR that would be ready in 15 minutes, right? That's ideally what we would have, but we don't have that, and we want everybody to have access to testing. So we don't want people to have to take off work and go to their pediatrician's office or CVS or whatever. We want the option to be available in the school, and this is the option that we have.
But I'd also like to say, parents, please, if you want your child to be tested, you have to let us know, because the team will not test your child unless we have, you have to fill out the paperwork. So make sure that you sign the consent, otherwise we cannot test your child.
So would a parent have to be there with the child?
As long as we have your consent, we can go ahead. But the nursing team, maybe not the high school, but the nursing team for the other schools will reach out to the parent and let you know, like, hey, I'm going to test your child. I already have consent, especially in the elementary levels. We want to make sure that the parents are aware. So yes.
I just want to look through some of the questions that came in. So some of them we've already answered. One question that we really didn't address is, will parents be told if their student is considered close contact or not? So if you're considered close contact, yes, we will go ahead and say, hey, yes, we will, we will let them know. So if, like I said earlier, if Carmen's my close contact, I will share that data with her. They will inform the students that are close contact, but we also will share the information with the rest of the class. So, hey, you were in a class, there was a COVID positive student, you were not close contact. And then we'll also, in that data, let them know if any of the students are using option 2 for a quarantine. So let's say Carmen decides, hey, I was in close contact, I am going to quarantine at home. We will let the parents know that in that general class communication, so they are fully informed if a student that was in close contact remains in the classroom. So I did want to make sure we were aware of that.
And what as a nurse, do you have a place to say, hey, your child needs to get checked, or do they always gotta have a fever? If they got this running noses, how are you guys gonna address that? And the child come and say they're sick, and their parent, oh, they'll be over this. So, I mean, is there gonna be a stricter protocol for this now?
So we actually started that stricter protocol last year with the nursing team. the nursing team felt we were more lax before, pre-COVID, because we know allergies are out and everything like that, but we've gotten to the point where we let parents know, hey, this is what's going on, we assess your child, because we're blessed to have all our in every school, and so we can assess the situation. Determine, hey,
That's okay.
even without testing, say we don't have a parent that okays it, you need to pick up your child, and you need to pick up your child within the hour. That's our ask of all of our parents. And we also have what we call a get well room. So if the parent, say, can't get there right away, that child will be in that get well room away from the other students that may be in the nurse's office. And they'll be monitored, of course. And so that's what we are working through. And I believe that, Dr. Furman, if you knowingly send your child and they have COVID, we've had some discussion around that, how that will follow through with that. You will probably be asked that your child remain virtual if you're knowingly sending your child and they have COVID.
But not even so much COVID, if they, okay, they come, they have a fever, they don't necessarily have to be COVID. If they have very bad allergies, because they have medications, because allergies can turn to something really bad.
Sure.
If you don't treat them, a lot of people don't like it. They say, oh, we just let them run their course. But when your allergies turn into something that's pig eye or green, because kids are gonna wipe, you know, they're gonna touch, and they're not gonna be as sanitary with this mucus and all that stuff. So now what I'm saying is, are you gonna be looking at everything other than COVID? Because a lot of this stuff can lead up to the surface stuff, because I mean, I've seen, I've had to wipe plenty of noses, you know what I mean? And it's a lot of our kids are capable of keeping themselves germ-free, you know, sanitizing and stuff like that. Because that's how it is.
So our team has been accused already of being overly sensitive, and I'm sure other nursing in schools have also been accused of that. But again, we do have the RNs, and we do understand there are other respiratory infections out there. There are other, allergies do exist. And what we do ask the parents is, our first layer, honestly, of the mitigation is all of us. We play a crucial role before the mask, before the hand washing. So to piggyback what you said, it's about us working as a partnership. So if our parents are not working with us as a partnership, by filling out the paperwork at the beginning of the year saying, hey, my child has allergies. Because if we don't have that, and your child is constantly in our office and that baseline does not look like allergies, or, it looks like something new, we're gonna call you, we're gonna send that child home. But if you let us know this child has allergies, and then we check off the other boxes, and again, I'm very proud of the nursing team that we have. We have RNs, but we also have some practitioners on our team. And so they take this very seriously. And again, we've been accused of being overly sensitive about this.
Can I just make a comment if I could just make a comment to piggyback off of that, I think that reinforces the reason why it's probably the best idea to start the year with masks in place, because a lot of these viruses are going to look alike. You won't be able to tell the difference between COVID with just respiratory symptoms isolated versus paraflu, which is at a peak in the emergency department right now. It's making asthmatics flare, all of those things. It's gonna be very difficult to tell the difference. I just want to say that probably reinforces why we should start the school year off this way. I think that one of my earlier points was, I think that this is also reinforces why we as a community need to investigate and think creatively and really put our minds together about kind of the big elephant in the room, which is lack of affordable childcare. And I think that that's why a lot of these parents send their kids back to school, is because they can't lose their jobs. I know that, many of us are in similar situations. And so right alongside learning loss is affordable childcare. And if you get a letter or an email that says tomorrow your kid can't go to school, well, then what are you supposed to do with that? And I think that's where, before the school year starts, before we get into the thick of the winter, we have to really start to think creatively about how, we work together with that, because otherwise you're gonna see parents that give their kids a dose of Motrin and send them on their way. I see it every single shift I work in the emergency department, where the first question is, when can they go back to daycare? When can they go back to school before they even ask what the diagnosis is? And it's not, and I get it. And I think that is because we really need to concentrate on how we can effectively help families quarantine if they're in quarantine, or effectively help parents do this option too, which makes it such that they can't go to after school. They can't go to Animal Crackers. They can't go to Whiz Kids. They can't go to those things. So we have to just start to creatively think about some options for that, which is a community-wide and a system-wide problem. It's not just a CDC problem.
Yes. Okay, well, that, I think we covered most of the questions that were in there. If we did not get to your question live, our time is up. We're about 15 minutes over. We will capture those questions and add those to our Q&A. So all the questions that were submitted online, I've got those. We've crafted answers for those. We'll post those answers. I'll also be sending out an independent communication to everyone that responded, just if they had some individual questions that were more specific to a certain family, just to thank them as well for submitting that question. But I also want to then just finally thank our panelists again for dedicating this time and volunteering your time. I know I could not pay you your hourly rate. Thank you. All right. Thank you, everyone, for attending. We've recorded this session, so if someone was not able to be here, we'll post it. We'll send the link out in the Friday follow-up next week. Thank you, David. Appreciate you being here.
Thank you.